Hildegard Peplau and her theory on interpersonal relationship in nursing. The people behind this presentation are Mariñas-Parrel and Dorothy Mariñas. These are our goals in this presentation. First, to know Hildegard Peplau more and know her biography. Second, learn a little background about her history and how she made the theory. And third, know the different assumptions made by Hildegard Peplau in relation to the four concepts of nursing and nursing meta-paradigm. To begin, Hildegard Peplau is the theorist that established the interpersonal relationship in nursing theory. She was born on September 1, 1909 in Reading, Pennsylvania. Her parents are Gustav Peplau and Ottilie Peplau, who were immigrants in Pennsylvania. Moreover, she is the second daughter out of the 6 children in the family. She was always observing people's action as a child, and she lived through the tragic 1918 flu pandemic, which profoundly shaped her knowledge of the impact of disease and death on families. Despite the fact that higher education was never mentioned at home, Hilda was a strong-willed woman with the ambition and vision to evolve beyond traditional women's role. She desired more from life and was aware that nursing was one of the few job options available to women at the time. In 1931, Peplau graduated from the Pottstown Hospital School of Nursing in Pottstown, Pennsylvania, which began her nursing career. She then worked as a staff nurse in New York City and Pennsylvania. Peplau was then recommended to become the school nurse of Bennington College in Vermont after working as a nurse for the New York University summer camp. In 1943, she graduated with a bachelor's degree in interpersonal psychology in Vermont. After that, she studied psychological concerns with Erich Fromm, Frieda Fromm-Richman, and Harry Stack Sullivan at Bennington, and through field experiences at Chestnut Lodge, a private psychiatric clinic. Peplau's entire career was devoted to expanding Sullivan's interpersonal theory for use in nursing. From 1943 to 1945, she served in the Army Nurse Corps and was posted to the 312th Field Station Hospital in England, which housed the American School of Military Psychiatry. She met and collaborated with key luminaries in British and American psychiatry throughout her time there. Peplau was at the table with many of these same guys after the war as they fought to alter the mental health system in the United States through the 1946 passage of the National Mental Health Act. Peplau earned her master's and doctoral degrees from Columbia University's Teachers College. The William Alanson White Institute in New York City also qualified her in psychoanalysis. After that, Peplau created and taught the first classes for graduate psychiatric nursing students at Teachers College in the early 1950s, in which Peplau established the first graduate-level program for clinical experts in mental nursing at Rutgers. Peplau was truly an advocate for psychiatric nurses' advanced education. Nurses, she believed, should offer patients with truly therapeutic care rather than the custodial treatment that was common in the mental hospitals at that time. She ran summer courses for nurses around the United States in 1950s and 1960s, largely in state psychiatric facilities. She covered interpersonal ideas and interviewing techniques as well as individual, family, and group therapy in her lectures. Now you might ask how Hildegard Peplau established her theory. Nurses, she reasoned, might help people relate their experiences by observing, describing, formulating, interpreting, validating, and intervening. For example, as the nurse listens to her client, she forms an overall impression of the client's circumstances. Dr. Peplau stressed the importance of the nurse-client relationship, claiming that it is the core of nursing practice. With that, Hildegard Peplau's theory of interpersonal relations was published in 1952, and it was influenced by Henry Stack Sullivan, Percival Simmons, Abraham Maslow, and Neil Elgar Miller.
For Hildegard Peplau, nursing is a significant therapeutic interpersonal process. It is the human relationship between a sick or in need of healthcare individual and a nurse who has been properly trained to recognize and respond to the need for assistance. For her, environment is considered as forces outside to the organism and within the context of a socially accepted way of life. When patient adjusts to the hospital routine or environment, she advised that the nurse should consider to the patient's culture and customs. According to Hildegard Peplau, health is a word that symbolizes movement of the personality and other ongoing human processes that directs the person towards creative, constructive, productive, and community living. In addition, Peplau also emphasized the importance of meeting one's needs in order to achieve a sustained good health. Physiological demands and interpersonal conditions are the two considered needs. She defined person as a developing organism that intends to minimize anxiety or tension caused by needs. For her, the client is an individual with a felt need.
And that ends our discussion in this presentation. Thank you for listening, and if you have further questions, you may comment it down below.